Hey guys, welcome to my YouTube channel. I am really happy, I'm excited, I'm delighted to have you on board. Thank you for the continued support. I want to believe you enjoyed the interview with an amazing colleague of mine who has a passion in taking care of the dead in an honorable way. So if you haven't watched that clip, please do so. Today I want to talk about something that commonly affects women, especially those of the reproductive age, something which is a gynecological emergency. And if you present with symptoms almost likely or similar to what I'm explaining today, then you need to find yourself at the nearest health facility. What am I talking about, guys? I'm talking about ovarian torsion stroke ovarian cyst torsion. Torsion simply means something twists around itself. You know very well that the ovary is a very important structure in the life of a woman. It's responsible for the production of hormones that are going to guide key processes in the woman. The ovary produces an ovum through the process of ovulation, and when this egg or ovum is released, that is what will ensure that once the sperm comes in, there's fertilization, and eventually you have a baby forming. The overall is responsible for production of hormones that are going to basically determine the whole response of the body of a woman. So it's very important. Now, when it twists, it becomes an emergency, and most commonly you find it twisting if you have a cyst on top of the ovary. One of these days I was in hospital, and a young lady comes in with a lot of pain that seems not to be getting better. And so I asked, have you done any test? An ultrasound had been done. Looking at the results, everything was okay. They said the ovaries were okay, no cyst, but just described a mass in the bladder. Well, so it was a recent scan, and I told the patient, this looks like a recent scan. Everything appears normal. Let's try to investigate. But there were these very bad, sudden, sharp pains that were attacking her on the lower abdomen. And I kept on giving painkillers as I do other tests in the hope that I'll get what is going on. I remember giving almost all types of painkillers that were available in the hospital with very little improvement. We did a pregnancy test that turned negative. You know, everything was okay. Her kidneys were okay. Her urine was okay. So what was really happening? In an ultrasound done about a week prior showed that everything was okay. But lo, when a repeat ultrasound was done, it showed that there was actually an ovarian cyst that had twisted together with the ovary. Another case is one day I'm doing night in hospital, and I'm called at 5 a.m. There's a woman who is in a lot of pain. A lot of pain that doesn't seem to improve even with painkillers, and it's attacking the lower portions of the abdomen. And we do an ultrasound to find a very big cyst attached to the ovary. And so what do we decide to do? We decide to go to theater because it's an emergency. When your ovary twists, so assuming this is the ovary, and then this is the ovary, guys, and then this is a ligament that, this is the ovary, then this is a ligament that attaches it, let's say, to the uterus, and then this is your uterus. On this ligament, which is attaching the ovary to the uterus, we have vessels that are supplying the ovaries with blood, making sure your ovaries are alive. So when it twists, it's this, you know, it twists around this part is actually what twists, it twists. And the danger of this is that because this part that is twisting contains vessels that are supplying your ovary with, there is risk of blood supply to your ovaries becoming compromised. And if you're not taken into theater early enough for the right thing to be done, then you could end up losing your ovaries. So the most common presentation of an ovarian torsion, you find a person young reproductive age, and there's this sudden onset sharp pain that seems not to be improving with anything. It comes and goes, and nothing actually works. And then at the same time, because of the pain, you find that a patient is vomiting. Fevers are high, like this patient looks very sick. Get such a patient. Of course, we are doctors who love women, and the first thing we'd want to do is a pregnancy test to ensure that the patient is not pregnant. And then we'll also do a urine test, because at times you get very severe urinary tract infections that could make you have that kind of pain. And then, of course, we have to do a complete blood count to ensure that there's no infection and everything is okay. And at the same time, very important is to do an urgent pelvic ultrasound. It will show us the status of the ovaries, the status of the uterus, the status of your pelvic organ structures. Now, once we confirm that it's indeed an ovarian cyst torsion, that an ovarian cyst stroke ovary torsion, then we take you urgently to theater. Many times I want to just take you through what actually happens and a practical example of someone of a case where this ovarian torsion was present. So you find a patient, you go to theater, you open the abdomen, and this is what you see. As you can see in that photo, that very big thing is a complex cyst that had occupied the whole of the ovary. And then look keenly, there's that place where the ovary has twisted. And that's what was causing a lot of pain. What do we have to do? Number one is we have to untwist. And you can see there, it's been untwisted. And in this case, this was something very complex because it was attached. It was attached to the ovary. And normally you always have to warn a mother before that there's a risk you could lose the affected ovary. So you don't just take a patient to theater. We don't just take you to theater without you signing a consent and agreeing that if the worst comes to the worst, then there's a possibility you could lose your ovary. But of course, you want to be very careful to preserve as much ovarian tissue as we can. So we basically remove that. We remove the cyst. We untwist, we remove the cyst, and then we do the necessary adjustments that need to be done. And after that, we close you up and you're good to go. Pain solved, cyst solved, torsion solved, ovary saved. That's it from me, guys. If you have any question on ovarian torsion, don't be afraid to comment. And if you have any clarifications or anything you'd want to know, karibu. And I love you guys. I wish you a very beautiful day ahead. Thank you.